That's okay. We're just getting started. So, are people able to enter the chat? I don't know if that's actually a thing.
They
Yeah,
should
I think
be.
so.
Okay,
Yeah.
good.
Yes, yes, they can.
Okay, good.
Is your bridge out? You can hit that. It's okay if your bridge has a sign that says bridge is washed away, bridge is out. What bridge?
What bridge? We're just designing it. It's piecemeal. Yep, that's uh, under construction. Absolutely. So that's pretty common, right? That's why some a lot of jurisdictions they don't even talk about it as there being a bridge. When we layer things on really nicely, though, what you'll see is you can have like a triple decker bridge, or you could have. So I think there's kind of a best case scenario of how people build this bridge between science and practice. And so that's really what I want us to start wading into, and then I'll be going through each of them. So kind of keeping with that thought process, most people already consider like this micro level, and this is really at the program level. Do you have high quality interventions built into your continuum of care? Do they operate in the way that you hope they will? So that's really the way most people think of implementation science or evidence-based practices. So that's kind of like a one bridge. But if you think about it, one of the reasons I like to use this imagery is because in that model, bridges can go like traffic can go backward and forward, right? So researchers can give information to practitioners, but also in the best case, the best built bridge, information is coming back to the research institutes, and that strengthens that process. So we tend to think about like evidence-based practices at that micro level. But there's also like a meso or a middle level, and that's really when our systems work well together. So when you have programs that are functioning and linked together or interwoven together or share funding, years ago we used to use the term braided funding. Um, Really, it's the best case for youth and their families when there's some kind of systemic cohesion like that. So that's kind of that middle level. So that might be like a double decker bridge. And then at the macro level is when you have your overarching, maybe it's your continuum of care, or maybe it's broader than that, like maybe your county board, your city, your state. So at that higher level, do you have that overarching support for research being implemented into practice? So not too many places have all three levels, like that kind of sleek triple leveled bridge going into their communities. But I want us to think about it that way because frequently we don't. And then just to simplify some of the language, uh, oops, I think I went backwards. Next. It's making me click funny. Thinking about this in three different, again, using the three different approaches, when you think about implementation science, when we think about that program level, we're really thinking about what are we doing? What do we do? So what kind of programs are we operating? Sometimes it's called implementation strategy when we're talking about how do we do that. That can be at the program level, but frequently in the best model, it's when you're looking at your systems. How do your systems function together? And then implementation culture is that final level of what are the perceptions and beliefs of why we do this work, and the importance of incorporating research and data into the programs that we run. So I want to spend some time around each of these because I'll probably spend the least amount around evidence-based programs because we've had quite a bit of discussion, I think, in the juvenile justice world about this. But this is really when, if you think about from a practical standpoint, when a program, let's say a practitioner sees something at a conference and they bring it back, or they know that they have a gap in their community and they go out to model programs guide and they research a certain age group and they think, I want to implement a program that's been researched and I want to implement that in my jurisdiction. So that's typically what we think about when we think about implementation science. We think about finding a model program and then plugging it in. I would argue it's not like we need to go further than that because, and most people would argue that because we need to operate that to fidelity. We need to know that we're applying the program to the right population. Also, and if you're going to a website like Model Programs Guide, those programs have already been researched. But in our jurisdiction, we had a little bit of trouble just recognizing, like, what does it mean to be evidence-based? How many research studies is that? What kind of research has been done? So really, when we look at the program level, there are still some questions. It's not as simple as just pulling a program off of the shelf. So I want to spend just a little bit of time talking about this. This term, random acts of intervention, it always kind of makes me smile. I stole it from an implementation science podcast. I think it's called BAT Implementation Science Podcast. Not very innovative, but it's a great podcast if you're an implementation science geek. But what we find sometimes in jurisdictions is that they'll go to a conference and then they'll come back and they'll be like, oh, this was kind of a cool program. And they'll just start implementing something. And it may not necessarily line up with the gaps or the needs that they have in their community. So I think that there's been a lot of work done around the continuums of care to look at what the gaps are so this exact problem doesn't happen. But being very mindful of when you're implementing something that has proven that's proven effective, that you do so in a way that maintains fidelity to the model. So it's matched to the need, matched to the population that it was designed for, and that you maintain the implementation as it was designed. So if it calls for 12 sessions, that you have 12 sessions. It's really harder to do than how I've just laid it out. It's never that simple. It's really hard to pull something off the shelf and implement it to fidelity. And the other area where I think we kind of fall short, even on the program level, when we talk about implementation science, is we sometimes don't recognize the practical aspects of who will be served, or the mechanisms and barriers is usually the language that's used in implementation science. But let's say, perfect world, that in your jurisdiction, somebody found a model program, it maps to the gaps, and they want to implement this, and they're doing it with fidelity. So even when all the stars align, I think we still have two kind of shortcomings that happen around model programs. And what happens is that sometimes programs never go back and evaluate just how effective they are after they've implemented that. Second of all, sometimes they're comparing themselves to nothing. So let's use the example of a diversion program. Years ago, I used to do a lot of evaluation of diversion programs, and they would be like standalone evaluations. And so they would be like, hey, we received 1,000 kids, and we had 80% signed up, and 50% didn't reoffend or didn't have a subsequent law violation. But see, if you're not comparing to something, then you're really not, it's not as effective. So one of the things that we started to do in our state, in Nebraska, and you're going to hear more about this in a minute, is we've started to kind of have comparative program evaluations. And I'll be super transparent. A lot of times people don't like these because it's easier just to compare myself to me, right? To compare my program to me, or to keep it internal. But when you do comparisons between two very similar programs, it starts to generate questions about why. So why do I have a different response rate? Why do I have a higher recidivism rate? Why does it look different? So I really encourage programs that are similar, if they're aiming for the same goal, to have kind of a buddy system and to work collaboratively with another agency doing the same type of program. This is really interesting if you have one doing kind of a model program and then one doing a homegrown program, because then you can really see differences, and you can see, is the model program truly more effective? This really creates communities of practice when this is done well in a jurisdiction. If two different agencies can have a dialogue and talk about places they're effective and places they aren't, I think this is one of the largest areas for growth around implementation science, because they're literally talking about the research and what's working and what's not working. So I find this kind of work and research really exciting. So outside of just the program level, though, the next level that we want to think about from a systemic standpoint is this implementation strategies. And few jurisdictions, I'm going to give you a couple of examples in a minute, but few jurisdictions really look at how well do our programs interweave themselves. How well do they link together and really create a strong network, strong and efficient network for youth and families. So I want to give you a couple of different examples, and we're going to spend just a little bit more time here because, like I said, this isn't an area that's like widely thought of when we think about evidence-based practices or implementation strategies. Frequently, this is an area that we kind of brush over. But I think it's super important for continuums of care because it really links to the model of a continuum of care. It's really how well do your partnerships come together. Another way to look at this is just from an ecological model. So if any of you are social workers at heart, there can be like individual level, right, which would be like individual youth and families, but also individual level programs. And those programs then are housed within an ecosystem, right? Your county, your teams, your community. And then broader than that, you have like your city, right? Or your county and your state. And so each of those rungs really interacts with the effectiveness of a program. So I want to use maybe a really practical example. Let's say somebody from your team goes to a conference and they see a great model that addresses attendance or truancy issues. And they bring it back, and their first hurdle might be like just presenting it to their agency. And let's say they have a great progressive agency, and their agency's like, sure, let's try something new. We have the resources. So I know this is a little bit of a dreaming world, but so they say, let's do this, right? So then they miraculously hire the right team, and they're using this evidence-based practice, and things seem to be flowing right along. But when they reach out to the school, to get data on whether or not kids are in fact going to school and is attendance improving, the school shuts them down and says, no, that's a violation of FERPA and we can't share this data. So you can see like at each level, you need a group that can work together and can work as part of that team. And that's why I think thinking about this meso level is really important for continuums of care. I'm sure many of you have probably come across some of these hurdles already. Because when a program works well, that's awesome. But it's not enough for a program to be evidence-based, right? That has to work well within a system. So that's what I want to spend a few minutes giving you a couple of different examples. So I'm based in Nebraska. So I'm going to start with a Nebraska model. And it's a little bit of a story, so bear with me. But back in 2015, our legislature was really entranced with evidence-based practices. So much so that they literally, we have one kind of major pot of funding, and they wrote into statute, they said, programs shall be evidence-based. And so I was at a research institute at the time, and what happened is programs kind of spiraled out. Like our phone was ringing off the hook, and people were like, what? How do I do this? And people were like, breaking down the model programs website. And so it was a little bit of chaos, but because it was written into statute, people were really genuinely trying to implement evidence-based practices. In the Research Institute, I worked with another faculty member, and we were charged with measuring whether or not programs actually implemented evidence-based programs. And so we used a system that I'll tell you about in just a minute. But what we found is out of about 200 programs, maybe 1% actually were able to implement, like right off the shelf, and implement an evidence-based program. And some of that is just because Nebraska's a rural state. We don't have, there's areas that are not very populated. So we had some just kind of natural barriers to just implementing a model-based program. So what we did is about 2016, we went back to the legislature and we said, can we think about this like kind of engineer it backwards, basically. We said, we have programs out there doing what we think is good work. But we know that doesn't necessarily match what's in the research journals. So how about we work backwards? And that's literally what we did. We contacted and called about 200 different programs. We asked about, what are you doing? How are you doing that? What's your goal? And then we went back to the research journals and we saw whether or not those things lined up. And when they didn't line up, then we did training and we brought it back to the agencies and we said, well, have you thought about doing these kind of things with your program? Ultimately, we built a data set where programs were required to input data about some of those measures that we pulled from the research journals. And as you might suspect, the first couple of years were kind of a big miss. Like, right, we had programs that didn't enter data. We had programs that the system took forever to build. Like, there were a million obstacles. But long story short, really, over time, over a decade's time, a system was created that programs enter their data in, and we can see, does it line up with elements that are evidence-based? And so I'll show you the site. You can go out to Evidence-Based Nebraska. I'm no longer the director there, but you can go to Evidence-Based Nebraska and you can see we had to share definitions, right? We had to work across 200 programs and 93 counties, and like a lot of agreement had to happen. And it didn't start that way, right? But we started small and came up with definitions and then asked where people disagreed, built the system from that. And then we have a state agency that matches the recidivism. We actually call it future system involvement because some of the kiddos haven't had a law violation yet. And from this, every year there's data that's collected, because I think there's probably over 100,000 cases now in the data set. Like I said, I'm no longer with that research agency, but this project still continues. So there's a number of different reasons that this worked, but it's an example of implementation science kind of working backwards. And I'm going to give you a couple of other ones in just a minute. But this particular example from Nebraska, it informed not just the programs, but it also informed this kind of meso level, the level of decision makers too. Because what we found out is a lot of the, and you can get to all of these definitions on the website, but a lot of the interventions were directly working with youth, which is what we wanted to see. So about 80% of the programs in this year were directly working with youth. Some were direct events or things that were like post-prom parties, like it was a one-time event, and it usually to help youth not get involved in drinking or driving or doing high-risk behaviors. But we also found that there were things that we called direct services. So programs that weren't necessarily working on an ongoing basis with youth, but they were working to, like assessment centers would be an example of this, where they bring youth in and they assess them and then refer them out. But even that type of service has evidence linked to it. So for example, you would want to use a validated tool when you do that. You would want the turnaround time to be fairly short. You don't want kids waiting 6 months to be assessed, right? And then when you refer them out, you want youth to then connect to those services. So even with those kind of things that weren't direct interventions, we came up with some measures that tracked back to best practices. And system improvement is really things more like grant writers and kind of the backbone agencies so it's really like your continuums of care. So some of the funding went to that kind of a service. From this, though, we also produced reports that went back to those programs. Again, we got a little bit of pushback because these are, again, they're comparative results. So we would have, all of our diversion program results. The report that's right on the surface there, you can see where all the diversion programs during those years, 2012 to 2015. And so you could see very clearly kind of comparative results from one agency to the other. And sometimes programs didn't really like that, but it started that conversation of what other things could I be pulling into my program to make it more effective? Are there things in the research that I could be implementing? What's the program down the street doing that's making it more effective? So that really led to some communities of practice. And I think out of everything, maybe that was one of the most effective ways to have that dialogue at this kind of, larger level. So Nebraska isn't the only state doing this kind of work. So I want to give you a couple of other examples. The juvenile justice trials are an example of this. So juvenile justice translational research on interventions for adolescents in the legal system. So it's kind of a mouthful, but this was a huge initiative, a cooperative research initiative funded under NIDA, which is the National Institute of Drug Abuse. And it involved like Columbia University, Emory University, Mississippi State, Texas Christian. And what they were really looking at is do sites that are using or translating evidence into the field, if we do some enhancement of that, do they show better outcomes? In this cross-systems interagency collaboration, are there better outcomes when those agencies collaborate? And they were specifically looking at whether or not that linked to reductions in recidivism. So you can see kind of how these outer levels can implement or can influence, and researchers call it moderate, that relationship with how well programs can do their job or can keep kids out of the system. So an example of that is really like when we were calling around and asking agencies about the different goals, like what is the work you're doing? Sometimes we found agencies were like, well, I help families. And we'd be like, okay, like, can you narrow that down a little bit? And we found agencies that were kind of trying to do everything. And that was problematic, because typically when any of us tries to do everything, we don't do anything super well. So what we were able to do was to kind of draw people back and have agencies focus in on what they're really good at. And when we did that, we found about 15 different program types. What I find is really interesting is some of these other models. SPEP is another one of these models, which I'll talk about a little bit. It's not on the screen, but it's a model that was created by Mark Lipsey out of Vanderbilt. I believe he's now retired. But his approach was somewhat similar, right? Like looking at specific types of approaches to juvenile justice that might be more effective. So what he found was that certain interventions like cognitive behavioral therapy should rate higher in an overall scoring of program effectiveness. But also the quality of that service should matter. The amount of service, right? Like even if you have a model program, an evidence-based approach, if a youth only shows up twice, that's really not going to move the needle or show effectiveness. And then the youth served, really, the higher risk youth are the ones that should be served using an evidence-based approach. So there's a number of different kind of models that have looked at this system level, like how do our systems work together? And then how do we measure whether or not these programs can implement research that's been done. EPIS is another model. It's really exploration. I'm gonna have to look at my notes. I can't remember the different steps. Exploration, preparation, implementation, and sustainment. It's a little bit more of a medical model, but again, it's how do we take research from the field and have it and implement it? So using kind of a practical example, the exploration phase is really that point where you might be on your continuum of when you look at your gap analysis and you see something that's really missing in your community, let's say a mental health program. The exploration phase is where you're trying to match that gap to a program or a service that has research behind it. The preparation phase is when you're measuring or looking at, like, what are the obstacles to us implementing this? So, for example, in rural areas, you might know about the need, you might have a program you want to implement, but let's say it's MST, multi-systemic therapy. We have some rural areas in Nebraska that's the barriers are just too high. We couldn't keep enough therapists trained to use that model in some of our sites. And then the implementation phase, like if you find something that has few enough barriers that you can implement, going ahead and putting that in place and then running it and testing it. And the sustainment phase is really where you're exploring different levels, different ways to keep that sustained beyond funding. When the grant that goes away, how do you keep that model in place? So that's EPIS looks at, like typically it's used in medical models and substance abuse models, but I've seen it used in some rural schools in Colorado as well. So needless to say, when looking at how kind of programs work together, Nebraska's done some of this work, but the JJI trials were across 7 different states and 6 different research centers. So there's pockets across the US that are doing this kind of work. And then SPEP is being used currently in Pennsylvania. So if you put in SPEP in Pennsylvania. I think they're it's not called Crime Commission. It's like the Commission on Criminal Justice and Delinquency, I think, uses the SPEP model, and they have a really cool dashboard that you can go and kind of look at how are they using this kind of model. But again, it's just a little bit different way of looking at implementation. It's more at the systemic level, which lines up, I think, nicely with continuums of care. So the last area that I want to just talk about, again, it's one of the places we don't usually think about implementation science culture, I guess, unless you're a geek who listens to these kind of podcasts. But it really is important to have a culture and an environment where evidence-based practices can be used, that it's expected, that failure is allowed to happen, where people rely on data. So if you can create that kind of culture, it really opens a whole new world. So when I'm talking about culture, I'm really talking about, like, if you think back to your cultural anthropology days, right, back in college, it's really the shared beliefs, norms, behaviors around a concept. So this could be like at the agency level, or it could be your organization, it could be the city, region, or your continuum of care. It's like when you get a group of people together, how do they think and talk about evidence-based practices? And what this causes is really a climate, right? So you can start thinking about it's the climate around your bridge, super geeky. But that climate is really powerful, just like a huge snowstorm would be. So I'm going to give you some examples, because a strong implementation culture really creates that environment, and things either thrive in that environment, leading to, productivity and good outcomes for kids, or they get shut down and like literally like a snowstorm, it shuts things down. So this can be a really positive or a negative thing. So just some practical examples. Obviously, a positive climate for innovation would be things like if you think about you're away at a conference, you see this great model, or you're on model programs, you see this great model, and you go to your boss and you say, "Can we try this?" And they're like, "Yes, let's do it." That would be an example of like a positive climate. Or you bring it back to your continuum of care, and you feel that kind of energy, like let's try this, knowing that things are going to go wrong, right? There's going to be things might not work as perfectly as it does in the research. But there's also negative climates for change, right? So sometimes you bring something back and people are like, "Oh, heck no, we're not doing that," or "That's risky," or "What if something goes wrong?" or "What if a kid gets hurt?" is sometimes some of the things I've heard for programs I've suggested. And they're just like mentoring programs, right? Like, I'm not talking about skydiving or something crazy, but so that kind of climate really impacts whether or not new ideas come into your continuum of care, into your agencies. And sometimes this gets so intense that it really leans into more like fear. And that might sound, I'll give you a practical example from Nebraska. I think I mentioned when we did all of these, we broke down all of the programs and we brought in research. Eventually, those amounted, in the last couple of years, we've been doing individual reports for programs. And so let's say out of our 50 diversion programs, each of them got an individual report evaluating how well did kids come into their program, did it match the population in their community, and how likely were the kids to recidivate or have a new law violation. And so there were times where programs, maybe their results were not as good as they hoped. And there were times they would ask, "Is this going to impact my funding?" So I think that's probably a phrase we've heard maybe more often than we'd like, is when we get bad results, do we have a mindset where we're like, "Well, let's see and explore how we can make this more effective," or are we fearful that funding is going to go away? So having that really supportive climate can either go towards, existing programs or new ideas. But overall, it's really powerful to have that level as well as the other two levels. So just a couple last ideas. You might be wondering, well, how the heck would I know if I have a good implementation science culture? Like, what a weird idea. But you can look at things like, I mentioned the laws in Nebraska for a while specifically stated evidence-based programs. So if you're seeing that kind of language or even those kind of concepts in your legislation, then that would be one indication. Another is just trainings. If your continuum of care or your community or your funders are really promoting research and having trainings around that, that's another great measure. But you can also just feel it in the attitudes. Like I've given you a couple of really silly examples of just finding an innovative idea on a website, and how that's received is just an indicator as well. Finally, this usually trickles down to the programs. Like if you have programs that are innovative and you have a whole slate of them, typically this will be an indication of a good implementation science culture. And all of this eventually translates to better outcomes for youth and families. So those are some of the measures that you can kind of think about when you're trying to measure, do I have this culture in my continuum of care or in my region? Kind of an older example, but some of you might have been around for this, but back more than a decade, in 2011, Kania and Kramer came up with the collective impact kind of measures. And what they were looking at, the same kind of thing, like, do our systems work together? Do we have a shared agenda or a common agenda? Because sometimes we work in a group and we're not all working towards the same end, right? So they had 5 different measures that they found when you have a community that really has this good culture, that's open to new ideas and innovation and evidence-based work. You have common agenda, you agree to some shared measurement, you work in a way that's mutually reinforcing. So let's say I refer people out for mental health services and they refer back for truancy. So you have agencies that are mutually reinforcing each other. And then there's some kind of communication process that's happening alongside this. So people are talking and meeting regularly. Typically, this doesn't happen just with agencies working together. Typically, you need things like a continuum of care, like you need a backbone support agency. And I showed you a few screens ago, like Nebraska has some of those that are funded. All of you with continuums of care have that kind of that structure that comes together, because it typically won't just happen. So I've been talking for quite some time now. I think we are at a point where we can do a little bit more digging in a couple of different rooms. I just don't know how many rooms we'll end up in. So
We have 20 participants right now. So, and I can make it so that people can choose which of the 3 rooms they can go into.
super.
So we want to do that.
Yeah.
Does that sound
right.
good? Okay.
Okay. I'm going to pause the recording while we're doing breakout.
And if you, I'm happy to start. But we had a pretty robust discussion about, you know, implementation science culture and thinking about the overarching theme was, yes, folks are open to innovation, but nobody wants to pay for it. So nobody wants to pay for sustaining it. Nobody wants to pay for implementing it. No one wants to pay to research it. So everybody's like, oh, let's do new things. But then when it comes to after the planning phase, or Mia, I know that this will mention this and this will resonate with everybody because I've heard it from all of my grantees. People get real tired of seeing programs come and they work and then their funding dries up and they go away. And then the community's tired of it, you know, and families are tired of it because they're like, oh, I don't want to, you know, get in this. So we were having this discussion about maybe finding champions. We talked a little bit about hooking up with state advisory groups, but also what other champions are good for like fostering this kind of culture that will help stoke the financial support of this. So if anybody has any ideas of people that walk around with bags of money because they want to implement stuff and do research, we'd love to know.
This isn't bags of money, but the thing that comes to mind is out in Western Nebraska. I don't know. I've always been impressed by how innovative they are. And that sounds crazy, but they had this something called the Panhandle Partnership, and it was really driven by, I think, desperate need, because it's something like, Jenny, you might know, 17, 18 counties or something, and like hundreds of miles separate these. And so it's like you would have one agency and then one agency far away. And they always come together regardless of funding, like they somehow have built it into, so just having that discussion and that coming together. I think they still do this, but for years, I would like literally drive across the state 8 hours to just see this in motion kind of thing. But then they've also had some leadership that was able to access some funding. And by kind of I think keeping that energy alive and having that group of 16 counties really attracted some funding. I think because that kind of cohesion is unheard of, right? Like 16 counties working together. That's wild. And it was very rural. So there was definitely a need. So that's kind of what was coming to mind. I know that's not probably a great answer for our metropolitan area, communities of care. But
They could apply for funding, though. I do think that's a thing to think about. Do you have coalitions or places that can apply for funding? One of the other things we talked about in our group is sometimes the the culture around implementation is stick it all here. These people will manage it. These people will manage it. These people will manage it. And maybe that's not the right place. And I think the thing about the Panhandle Partnership was those people all, because of necessity, were doing all the 17 things and just like trading seats, but they could apply for funding as the Panhandle Partnership. So they would be able to do that. So if there's local coalitions that might be a better house for and more financially able to apply for things, that might be a thought.
The other thing is within that Panhandle Partnership, there were some agencies that were quite small and really couldn't handle the support of a big grant. But by having some of those larger agencies at the table, like one of them was the public school system, and they were able to house kind of the infrastructure that could handle the funding versus those smaller agencies. So yeah. I also just think even multiple agencies in a metro area coming together is a stronger funding place to request funding from foundations, right? So versus a standalone agency.
Yeah. And Mercy just put in the chat, if you already have a plan to have a lot of buy-in. And I think that's true.
Yes.
And I think it's true because this plan also does have a cost analysis piece to it. So thinking about that. And then I think when you layer on top of it what Anne has been talking about, which is that, there is a piece to see, is it working? Is it working well? Is it working the way we thought it worked? But, that too, I think sustainability wise is attractive to funders. But yeah.
Just being aware that you're measuring outcomes already, because I think a lot of people start with a grant and then they start collecting the data versus like in the research world, we call it like if you've done a pilot project, right? If you've done a pilot, you're in a stronger position to request funding because they know something has worked or you at least are aware of what's not working. So that's definitely a place to start. But those are tough questions, that no payment, but I can't stress enough, like this continuing to meet. This is like kind of a random example, but I think it's been 20 years ago that Nebraska required each of our counties to come together around teams. And as far as I know, for years, there was no funding necessarily attached to it, but they came together as teams. And I don't know, things happen when you come together as agencies and continue to meet. So I think that's helpful, maybe.
Yeah. Join us next January for sustaining your continuum planning.
Yes.
So, which we're kind of delving into. I mean, I think these things are so closely tied, right? Like implementation science and having money to do it. You can't really get around it. So I don't know, Anne, if you and Romero had any thoughts or like questions that you want to pose to the rest of the group or think would be helpful. Or if you guys have questions, you can just come off mute and ask them too. Want to use your time.
I'll kind of summarize maybe what our group started talking about and then just open the door. Please, anybody from the group jump in. But we were talking about specifically like diversionary models and whether that's kind of too far down the system. Like, should they be prevention promotion? Should we be getting youth earlier in the system? And then kind of what are the different models that you can use. And I open the door. Any of you can go to Evidence-Based Nebraska. Definitions are out there, and sometimes starting with a definition, if you're looking at a program, is helpful, right? Because people can agree with it or disagree with it. You can say we want to do more than that, or we want to be earlier in the system. We don't want to wait till a kid's already got some justice system involvement. So we spent some time talking about the kind of that point in the system. And I think that's because that's what the participants, that's the point where they're thinking about building out, is around diversion. But definitely some also preventative areas as well. I don't remember from our group, were there questions? I'm like looking at my notes. I'm like, I don't remember a question. I think you're on mute, Jenny.
I was just going to say, what about Romero? I'll let him go.
Well, Michelle, it was myself and Michelle Davis, and and yeah, we had a lot of Davis connections, y'all. So you'll be too mad, y'all missed it, okay? But we actually, just because since it was just the two of us, I mean, we really talked about kind of all three in a way, a little bit as we were going back and forth. But I think one of the things that, and Michelle, please add anything. When it came down to talking about like evidence-based programs, one of the things that even that I brought up is how, depending upon what region you are in places, especially with programs, thought processes could really drive what people support when they think about evidence-based, right? Like, for instance, being in the West Coast in California, when there was some evidence-based programming and different things, because of how they think about children, so to say, and juveniles sometimes drove what was different and supported within an evidence-based program space. Being here in Texas, right, with the kind of a different thought process around children, drives really what is, I don't want to say accepted, but what is looked at as, hey, this is still evidence-based, right? Even if we know that maybe some of certain things that have bad outcomes aren't necessarily supported. But the thing that remained the same is in California and here, maybe people will argue or whatever, but I'm just using it as an example of being in both of these two different places, is that the children and families typically are the same, right? They're interjected in the systems that and have interactions the same. There's some nuances, but it's pretty much the same issues, right? But it's thought about differently, where social emotional base might drive an evidence-based program versus somewhere here, like even a scared straight program might do something different. You know what I mean? So,
Yeah,
anything, Miss Michelle, go ahead, Ann.
I was gonna say that's kind of where we were right when we went into, we got stopped as we were talking about kind of who leads it. If it's more of a health model, you lean in different ways with your families versus if it's more of a justice system involvement. And I have to say, I think that's the power of, if you can interweave your agencies, you really can do a better job, especially when you start talking about like dual adjudicated kids. Because sometimes a kid who walks through your door for truancy is the one area in our state that we've had the most discussion about this in particular. Because when kids are not going to school, it could be everything from they're working to support their family to they're playing video games to there's a substance abuse problem or the parent has, it's like, so that's where we really needed to interweave our response. And so I think it's interesting. You guys were starting to talk about some of the same things, like kind of who your leadership is, or maybe what state you're in, is how you lean into a particular problem. And hopefully we can lean into it by responding to the need a little bit better. And knowing what that need is, right? So those are all evidence-based, like just doing the assessment so you know what the need is, and then having, I know this requires funding, but having enough agencies that can respond to a particular problem. And I mean, Nebraska doesn't have a ton of money. So sometimes I think, like, if Nebraska can do this, I think we can do this, right? But there has been really good legislative leadership. So I will say that's one area that we've been very fortunate and in being proactive and allotting funding for a variety of different programs. So,
And I think like knowing, like, I think one of the things Michelle brought up is like who does what kind of in a way, like, who's doing what across the county, who does these services, who, especially community based and, and different things like that. And, you know, um, really helps, at determining, thinking about what types of programs, who you're going to partner with, who's going to do what, across the county or a location, city, whatever else it may be. So, I'm right with you, Ann. I'm right with you.
who does
Yeah,
what is huge.
yeah. I was just thinking it's when we started our discussion talking about that there's a lot of agencies that say they just do everything. And we aren't in a funding world where that's really going to be able to fly anymore because we can't have duplications of everything. So that may be, I'm so not an optimist, and now I'm going to sound like I'm a total optimist. But if you know me, like I can come up with a worst case scenario for anything. But this is an opportunity to say, like, we have a limited amount of funding. We have to measure what works and where it works best. Does it work best coming out of this agency? And how do we like braid those things together, which is kind of what you're doing in your continuum funding. Instead of saying we're going to have 50 places that do it all, we're going to have one place that does this, but they coordinate and communicate well with this. And it's those in between pieces where I think there's also a space for some evidence that says, if we coordinate well, we don't need 50 places that do the same thing. We only need two. But what we can show is what we do need is someone to make sure that that's a warm handoff, or that's, that's another place I think that you have some opportunity to provide some data around what happens if you coordinate things well.
I
Because you
got
can
a
have
question.
lots of great programs and no coordination, and everything falls through the cracks.
Do y'all think a lack of like research funding specifically or researchers like also plays into like maybe some of the woes of sustainability in a way? And like, you know, like how many places have dedicated research,
Yes.
might affect,
Yeah.
the sustainability side of the table, and participatory research if it's community involved or whatever else it may be, which a lot of folks are trying to do at the same time of, if that makes sense. But
Yes, I'm glad you brought that up because one of the impetuses of the way that this came about in Nebraska was exactly that. We had a couple of larger counties that had kind of the bandwidth to write grants to be evaluated. So those kept getting evaluated. But across the state, we had no idea where the funding was going. I mean, I hate to be that transparent, but there were counties where like the county would be like, well, let's buy a road grader because I don't know, that helps kids drive safe, right? So, or dare, right? Like we were just throwing money and hoping it worked out well. And so it was really that discussion of if we can you create an overarching system where 10% of the fund, so that's exactly how evidence-based Nebraska came about, is through our community-based aid dollars. The state said, we'll allocate 10% to work with the university, and you will do the evaluation across all these programs. I mean, now I think there's a little bit of angst because from an evaluation standpoint, it was not lucrative for the university because we're evaluating like 200 plus agencies. And they're like, if these were one-offs, like you would make a ton of money. But it's much better for the programs though, to have this kind of model. And it's not like major in-depth, like there's some regression analysis, but it's pretty low level program evaluation of are kids coming through the door? How long does it take for a case to get referred? And how fast does that warm handoff happen? Like, does the youth actually sign up? Is that different for different racial groups? Like, we're now able to answer a lot of really interesting research questions at the university level. But like I said, there's a little pushback because that 10% now, people are like, that's not enough money for what's happening. And I'm no longer there. So sometimes things are just driven by passion, right? Like I'm like, I'll do it for free because I like implementation science. So like hopefully right now the infrastructure and the law, like it's all written, so it will continue. So I hope it does. But I think, to your the issue you brought up, that was exactly it. Like they built this in, they baked it in, so research would be done for programs that sometimes have. In fact, we had to draw a line. If you serve less than 10 kids, we don't want to do a report, right? Because it was too much work for the trade-off. But we have some really small rural counties that have programs, but they get information now. They get feedback. In fact, if you want, we have a couple of counties who are willing to share what those reports look like. Like they're just simple information that would be useful. Like if you were a business owner, you would want to know how many people come through the door. Were they happy with the service? Would they ever come back? Like it's those kind of very basic measures that the programs understand them and people understand them. So it's not super high level. Yeah, Jenny, I'll follow up with you and with
Yeah.
Odo County specifically has said we could share one of their reports, but it's
Yeah.
it's an easier way to bring in like all of those measures link back to some research. So again, it's an example of implementation science in practice, right? Like people are using those to decide how to run their business, basically.
And
So
it's the culture level, right? So, like, you had the legislature driving the need for implementation, which drove the funding, which then drives that culture of saying, like, everybody's going to participate in this. And then they can use that to pursue additional funding. Um, but I also hear you, and I think especially now that there is sometimes a fear that, what if this shows that we're not doing well? So thinking about if this is something you're implementing, how do you get past that barrier to say, like, this isn't to rule you out, this is to say how to optimize your programming. What do you need to make it work if it's not working because it already exists? I just want to acknowledge too the comment about that Mia put in there that research happens after the fact oftentimes. So yeah, and that does, and not starting with the research, which is, I think, one of the cool things about this COC planning grant is that you're doing a needs assessment, you're doing a gap analysis. So instead of just saying, we're going to put in this program because we think this is what our community and our families and kids need, you're saying, we think this, now let's go see what do we have, what do we not have. So you are kind of starting with this hypothesis that there are some gaps someplace, but you really are doing some of that research ahead of time to set you up. So I think that is unique. So I'm mindful of our time. We just have a couple minutes left. Does anyone have like a burning implementation question?
oh, please.
Yeah, I know. If our junior high selves could hear us talking about implementation science now, they'd be so disappointed in us. So, anybody? I really appreciate this discussion. It's something you can keep talking with your coach about. Like I said, I think this is going to flow into our sustainability discussion quite a little bit. But when we send out the recording for this, we can send that Odo County example. And then you can just look up evidence-based Nebraska on Google. And there is a ton on that. So
Everything's out there except for we don't post the individual program reports because we try to keep so the aggregate reports are out there that have individual level data. It's kind of complicated, but
yeah.
the separate report you'll see a little bit more what I mean. So.
And Monica Miles Steffens is another TA coach, and she wasn't able to join us together, but she and Ann did Evidence-Based Nebraska together. So, and Ann is still on our expert advisory panel. So if you would like Ann to join one of your calls, I feel like I'm just doing an infomercial but We geek out over giving TA. So if you want Ann to join one of your calls or Monica or both, we can set that up for you too. So
Absolutely.
thanks everybody. Thanks, Ann.
Yeah, you're very, very welcome. I love talking about this stuff. So,
Yeah.
all right.
Make it
Thanks,
interesting.
everybody.
Thank you so much.
Bye.
Thanks,
Bye-bye.
good people.
Bye.